So next up, we have Dr. Richard Rosenfeld. Dr. Rosenfeld is Distinguished Professor and Chairman of Otolaryngology at SUNY Downstate Medical Center, where he's also Program Director for Residency Training and President of the Medical and Dental Staff. He is the founder and chair of SUNY Downstate's Committee on Plant-Based Health and Nutrition and also the Vice Chair of SUNY Distinguished Academy. Dr. Rosenfeld.
Glad I got up early and worked out in case I got to do the contortionist things to advance the slides, but I think we're past that. So I'm in the really enviable position of, one, speaking after two of the best speakers you've probably ever heard, right? You know, and three, being the only thing between you and plant-based lunch, you know, which is really bad. And before I forget, if you do leave early and skip the plant-based lunch, which you'd really be foolish if you did, turn in your CME forms, okay? So we'll make this quick, and then we'll go eat a good lunch and talk. We have a position statement. That really gets you excited, doesn't it? I mean, you know, how many of you woke up today and said, I hope I'm going to learn about a position statement, right? Yeah, exactly. Well, it's in your handout, but what is this kind of thing? You know, it's a point where you kind of articulate your beliefs as an organization about something. You try and build understanding and support, which is what we're doing today, and hopefully it's based on the best evidence that's been filtered through someone other than yourself, like a committee. So that's what we've done at SUNY Downstate. And here's the website, which I would encourage you all to go to. It's our website on the Committee on Plant-Based Health and Nutrition. One of the good things about being president of the medical and dental staff is I can just create committees. It's a wonderful thing. So I said, I'll create a committee on plant-based health and nutrition. About a year ago we did this, and this is the culmination of that. But it's on the handout, on the back of the position statement in your folder. I encourage you to go to the website, which is at the bottom there, and there's great resources. Evidence, for example, evidence summaries. You can see all the studies that are behind what I'm going to speak to you about now. You can see myths and facts documents. You can see frequently asked questions about all sorts of aspects of plant-based health, and there's even a really good getting started guide that sort of demystifies a lot of the aspects of making a shift towards more plants in the diet. So please go there. Now here's the question. I was introduced as the chairman of otolaryngology, right? That means ear, nose, and throat in English. So, you know, I'm normally up here. I do a lot of speaking. It's normally about earwax, you know, or, you know, too many boogers in your nose, sinus infections, you know, you're clearing your throat because you didn't eat enough plant foods, you got reflux, all right? So why should you listen to this guy, especially before lunch, talking about plant-based health and nutrition, right? Well, I'll tell you, it always begins with a case study. There I am in all my glory. I think I must have been about 2, right? You can see I was already becoming an advocate of good health and fitness and nutrition, right? You know? But don't worry, I was very interested in fitness, you know, getting the poses out there at that time. All right, good. You know, terrific. So then what happens? Well, my dad was really into fitness, and you get to high school and you say, all right, it's time to do something. Then you go off to college and you start pumping iron. All right, there I am in college, you know, 140 pounds, pumping away, the days of Arnold, right? Franco, Lou Ferrigno, the Hulk, right? And then what happens? Life. There it is, career, kids, and life, where all of you are now. 158 pounds. This was about 3 years ago, and I woke up one day and I said, gosh, it's going to take my kids forever to get married and have grandkids. Do I want to be around for that? I said, yes, then I better do something a little differently, right? So first I'll show you where I am now, then I'll show you what I did differently. So, where am I now? All right? That is not Photoshop. Don't ask me that, okay? Now, our BP talked about his 4-pack or 6-pack or pack or whatever, okay? So I'm 60 years old and change, all right? I have such fun teasing the residents in our training program about showing me their 8-pack and stuff. But yes, I really do this stuff. So how did I get from the middle to the right? you know, and how do you do that, you know? Well, I thought it was things I did, but I learned from Dr. Katz's talk that I'm manipulating my epigenome, you know. It's like, okay, so manipulate your epigenome. I suggest you all read Greger's book, How Not to Die, if you haven't done that yet. I mean, that is really the classic on this, and, you know, I'm fortunate in my family, one of my sons, who you'll hear from later on the program, Daniel, is really becoming an expert in this, and he's the one who sort of pushed this in the family. You know, stay away from the junk. You've heard that, right? Run. I started running. I never ran in my life. 3 years ago, I lost a little weight. I was late for a meeting. I ran. I said, I ran 3 blocks. This is really cool. You know, I can run. And now I'm running 35, 40 miles a week and going to do a marathon in September. We'll see. Work out. Hit the weights. You can't just do, you know, exercise. I got to do fitness too, resistance training, all right? And there I am again, 8-pack, you know, got to go for it. I literally get up at 3:30 in the morning almost every day except weekends. Before coming here this morning, I ran 7.5, 8 miles. Okay, every day I do this stuff, every day of the week. It's a habit, all right? It's in the genes. Now I feel great. I got a lot more energy. I can still be awake even before lunch. My case, countless others, and volumes of research show that this works. So let's get into the real research part now. That's how I got interested in this stuff, and you know, I think you got to get a little mission-driven here to really spread the word. Okay, so what about this position statement that I know you're all just excited about? So here it is. Plant-based nutrition, emphasizing all the good stuff, can prevent, treat, and even reverse chronic diseases in adults. Now, this is a statement that has been accepted and endorsed by the medical leadership of this institution, the Medical Executive Committee. That's a big deal, all right? That doesn't happen in a lot of places. So all the luminaries, very few of which have come to this conference, but they're still luminaries. Some of them are here. And, you know, they're actually, I have to acknowledge, Beth didn't acknowledge at the start, but we couldn't do this without support. And the Medical Executive Committee, medical and dental staff have generously supported this conference, as have the President's office, Dr. Riley's office. The Brooklyn Borough President has really helped a lot with getting the word out and organization, and there are others as well. They're acknowledged in the program. But this is the statement. So what does this mean? Well, we have a few things within the statement. First, we say that, you know, if you eat more plants, you have less of all these problems. You get all the good stuff. Now, this is only based on evidence from 700,000 or more people in various studies that are shown here. These are epidemiologic studies where typically at baseline they'll do dietary assessments, they might repeat it, and they'll follow people for long, long periods of time and then see how they do. But even at baseline, they have a lower weight, lower body mass, lower cholesterol, you know, lower inflammatory things, etc. Now, the real sine qua non in medicine is the randomized trial. You don't see a lot of this. It's difficult in nutrition and lifestyle research, but there are some. And that really helps you tell if treatment works. So what about treatment? What about randomized trials where we take a group of people with some disease, type 2 diabetes, being overweight, cardiovascular disease. We randomize half of them to primarily a plant-based diet and the other half to some eat what you want. Well, we see that you can reverse and treat all these problems just by changing your diet. And these studies go on only a few months, typically maybe 6 months or a year at most. A couple of the ones we highlight in our evidence report are shown here. About weight is particularly good. And the good thing about plant-based diets, you don't just lose weight, but you keep it off. You know, the problem with many of these diets, you lose weight, everybody can do that, but you don't keep it off. And coronary artery samples, 2 of the folks you've heard about already, Esselstyn and Ornish, I mean, are really luminaries, and I suggest you look at their books so you can prevent, reverse, and treat these diseases shown in randomized trials. Now, you don't just want to have a population study and randomize people, you want longitudinal. You need to see what happens over time. And that's where a lot of these real big population-based studies are helpful. Some of them are going out 20, 30 years now. Median follow-ups, 10, 12, 14 years on samples, which is great, you know. So what's the longitudinal impact of this? Well, if you eat more plants, you're less likely to develop hypertension, heart disease, type 2 diabetes, colon cancer, gastrointestinal cancer, et cetera. You know, this is shown in these studies. We're not going to get randomized trials that go out 30 years and control everything, but the data are there. And again, these are some of the main studies, big cohorts that are out there. Collectively, over 700,000 people and growing. And they find new ways to get information. You know, like they say in epidemiology, a fundamental statistical principle is if you torture the data sufficiently, they will eventually confess to something, right? So if, you know, people are torturing these data sets in new ways, looking at indices of healthy foods and et cetera, and it's really showing the benefits of this approach. Now, other longitudinal things, probably the most important longitudinal outcome is death. Right? Mortality. Well, good news. Eating more plants, you're less likely to die from all these chronic diseases, ischemic heart disease, cardiovascular disease, cancer, pancreatic, lymphatic, and hematopoietic cancers, as well as all-cause mortality. I'm not sure if that means the taxi person on Clarkson Avenue hitting you with their illegal cab, but it might help with other things. I don't know. Good evidence out there. Vegan versus vegetarian. Do you have to be all in with this, or can you just shift to the plants? The evidence is not robust on this. There are not a huge number of studies that strictly randomize to a vegan, whole food, plant-based versus vegetarian, but the ones that do are starting to show that you really do better if you stick to the whole food, plant-based, than if you just get your toe in the vegetarian end of it. Okay? What else is in that position statement? A few other statements that we're really pushing here. As much as Meatless Monday would be a global sensation and eliminating all type 1 carcinogens, who processed meats would be great, we're just looking to push the needle towards more plants. And that's what the evidence really shows, is the more plants, the better. A whole food plant-based diet, which I'll describe briefly in a moment, seems to be the way to go if you're going to pick one of these. And there are all sorts of different diets in the studies. It's hard to figure it out. And as was nicely, it's all about lifestyle medicine. And yes, diet is at the center of lifestyle medicine, but there's a lot of other good things that people do when they're eating better, and that may confound a little bit our interpretation of the outcomes here. Okay, so let's, a few words on what is all this plant-based nutrition, now that you're hopefully all revved up about it from the borough president, from Dr. Katz, and now this thrill-a-minute position statement, right? Okay, so let's take a look. And you can raise your hand. How many of you are omnivores? Come on, fess up. Yeah, there's a few of you out there. I'd say 10%. All right, let's go up the chain now, all right? Flexitarian, the new word. You wish you were vegetarian, you're not. You still eat some meat, but you pretend that you're vegetarian. How many of you do that? Yeah, there's a bunch of you out there. Another 10% popped in. All right, the semi-veggie folks. You're a good veggie, but you slip in a little chicken and fish now and then, right? I did this for most of my life. How many of you do that? Oh, there's a couple of you out there. That was like 5%. Vegetarian. There you are. You might eat some dairy, some fish. Who's that? Vegetarian. Very few, very few. Okay, 5% at best. All right, now we're going to get really tough here. Vegans. All right. Wow, probably about 15, 20% of the audience. Very good. Now the ultimate nirvana and self-actualization and dietary and lifestyle change is whole food, plant-based diets, right? Who really does that? About 10%. I've been doing it now for about 2 years. It's not easy, but whole food, plant-based diets. So that's the direction we want to go in, more plant foods, less animal foods. I don't think you need perfection, but that's where you want to go. Now, what is this whole food, plant-based diet? Well, it means you're going to eat the good stuff, right? The fruits, the vegetables, the whole grains, legumes, beans, nuts, and seeds. All right, you're not going to eat too much of this, the refined, processed stuff, you know, the extracted oils, even heart-healthy oils like olive oil, which is only heart-healthy because it hasn't been compared to other things that are healthier, as was said before. But extracted oils are, in general, not very good for you. They're fairly empty calories, and you're going to avoid this stuff. If you do that, you're following a whole food, plant-based diet. But it's boring, right? Eating lentils and grains and chickpeas and nuts, right? It's boring here. How can you have fun eating whole food, plant-based? You know, food is the joy in life. Well, I mean, there's a lot of good stuff out there. And you'll see it with lunch. And to a lesser extent, breakfast. But lunch, you will see it with lunch. There's good stuff. How do you learn more about this? You know, a conference is one thing. Again, go to our website. We put a lot. What's different about our website, I think, is we've tried to be very evidence-based. So we've taken out the hype in a lot of these materials, and they've been looked at by dietitians, by nutritionists, by medical students, by practicing doctors, by community folks, by public health professionals. So there's a lot of great stuff there that we're happy to share with you. And there's a table out there about plant-based world. They're bringing it right to your doorstep, the Javits Center. It's coming. You know, the 7th and 8th, really major big conference on this. I signed up for this. I think it's going to be a lot of fun. This was mentioned before by Dr. Katz, this global burden of disease, where now it's diet. I mean, diet is driving chronic disease in the U.S., especially things like diabetes, type 2 diabetes, the cardiovascular, some cancers, right? Stroke. The hyperlipidemias, the cardiac profiles, prediabetes, obesity, it's all being driven by diet. Yet we don't talk about it, and we talk about it here, but not in general. If you haven't already seen it, see Forks Over Knives, okay? I mean, you can get it on Netflix free. Everybody's got Netflix now, I think. It's kind of like, you know, it's ubiquitous, but it's the story of Campbell and Esselstyn's, you know, quest for this and their research where they follow patients who are really, really, really sick, have had multiple bypasses and other problems, multimorbidity, not just a little morbidity, multiple chronic morbidities. And most interesting, I thought, was the producer, you know, Lee Fulkerson, who kind of took this thing on and said, while I'm doing it, I'll go whole food plant-based for a couple of months and see what happens. And he just dropped his weight, improved his cardiometabolic profiles, and really did well. So that is the end of what I have to say about the position statement. And I think the committee, the position statement was great. This conference is really a turning point for us. We're really blessed and delighted that you have ventured here today and are sticking around. And again, thanks to Dr. Katz. I know the borough president had to leave, and upcoming Dr. Ostfeld and others for sharing their wisdom. And hopefully this is the start of some big changes in Brooklyn that you'll all be part of. So I don't want to do Q&A because it's noon. I'm happy to stick around. If anybody has a particular question, just come up. But it is 11:58, and it is always better to release you for lunch 2 minutes earlier than 2 minutes later. So there will be people outside guiding you to the lunch, which is a short walk away. Enjoy, and we'll see you back at 1 o'clock.